Hi, I'm Dr. Angie Osmond. I'm a general internist and the medical director of the Medical Weight Loss Program at Cuyuna Regional Medical Center. I also gave the first presentation for our Living Well series, which has been 6 weeks long, and I'm giving the last wrap-up session today. This is just an overview of what we had covered over the last 6 weeks. The first week again was the introduction that myself and Vicki Munson did. And then our second week was Principles of Healthy Eating. Our third week was the benefit of exercise. Our fourth week was an overview of mental health and meditation and relaxation techniques with yoga instructor Jill Matson. Last week's session was by pulmonologist Dr. Greetens, where he talked about sleep and improving sleep and how important it is for our health. I'd just like to remind you that these presentations have been emailed to you, and they're in your email, and they're also on CRMC's YouTube site. So just to recap, we're reviewing the 5 pillars of health and wellness, the first being long-term diet or meal plan. We don't like to use the word diet because it implies a short-term meal plan. We're talking about making long-term lifestyle changes. That's why we like to refer to it as the meal plan. Again, exercise and activity, then mental health, self-care and stress management, quality sleep, and finally our community, our social network, our family support, and spirituality. And you can see from this slide, these 5 areas are really interrelated. I'd like to review also metabolic health. Metabolic health is determined by 5 factors that you can see on the right. 1 is normal blood pressure, 2 is normal blood sugar, 3 is normal triglycerides, 4 is a normal HDL, not the LDL but the HDL, and the 5th is actually waist circumference, being less than 35 inches for women and less than 40 inches for men. What this is really reflecting is how much fat there is around the organs in the abdomen. We know if people have 3 out of 5 of these being abnormal, they have metabolic syndrome, and this is basically a marker of insulin resistance. Occasionally we see patients that all 5 of these are normal, but their fasting insulin level is elevated. It is an early predictor of poor metabolic health. There was a study in 2018 that showed 88% of Americans are not metabolically healthy. It's actually an epidemic. So takeaways from this series: a goal of being metabolically healthy and to have a healthy weight. So number 1, the meal plan. This really is the most important factor. Improving all the other factors without changing what we eat will not really improve metabolic health or lower weight. The big takeaway on the meal plan is that we'd like people to eat whole foods whenever possible and limit ultra-processed foods and sugars. I want to review the macronutrients, the first being protein. Protein provides the most satiety of all the macronutrients. It's essential. There are amino acids that are absolutely required that you take in through your food. You cannot manufacture them. There's also a high thermic effect of protein. What this is, it's the amount of energy required to digest food. And for protein, about 1/3 to 1/2 of the calories from the protein are actually being used to digest and process the protein by your body. For carbohydrates and fats, it's only about a 10% thermic effect. So eating protein essentially speeds up your metabolism. Fats are also essential, the omega-3s and 6s. They have to be taken in your diet because you cannot manufacture them. Fats are essential for synthesizing cell membranes that are everywhere in your body, and they're particularly important in your brain and in your nervous system. You can make fat to store fat for energy, but you can't make cell membranes without eating fats. Fats are second to protein in promoting satiety, and there is quite a bit of controversy over what's considered a healthy fat. I think all are in agreement that hydrogenated oils and trans fats are definitely unhealthy fats. And I think all also agree that eating fats are still way better than eating ultra-processed foods. Another point is that fats alone do not raise insulin levels. Now here's our carbohydrate group, and these are the healthier carbohydrates. On the far left, we have our non-starchy veggies. Those are the most healthy. Then we have potatoes, or sweet potatoes, and in the lower left we have our grains, things like quinoa and wild rice. These have nutritional value and are healthy and can be eaten in moderation, the same as fruit on the far right. If you're in the 12% that are healthy, you can eat a lot of fruit, but if you're in the 88% that are not metabolically healthy, we really recommend limiting fruit to 1 per day. There are micronutrients in fruits and vegetables. As it turns out, all of the micronutrients are available in animal protein, except for vitamin C, which you can get from 1 serving of fruit a day or a couple of servings of non-starchy vegetables or from a multivitamin. These are our unhealthy carbohydrates. Basically, anything in a box or package or bag, these are not healthy. They are heavily processed. All the nutrients have been stripped out. They've been added back in. No one really knows how much you absorb from these things. You don't see breakfast cereal in here, but breakfast cereal is not healthy. It's just sugar, pretty much. One last note about bread in the grocery store, even if it says it's whole wheat and whole grain, bread in the grocery store is highly processed. Many farms where there is a lot of grain produced, they spray their crops with Roundup, and we really don't know the net effect of that on us if we eat that bread that's been sprayed with Roundup. The other main takeaway on the diet or the meal plan is meal frequency. Meal frequency matters. We recommend 3 meals a day with no snacks. We know that snacking has directly contributed to the obesity epidemic and poor metabolic health. I'd like to shift over to our second topic that Paul Stockman and Catherine Carpenter from Hallett presented on exercise. Paul talked about the book Younger Next Year, and this really emphasized aging versus decaying. And the take-home message is that we are not meant to be sedentary, and that being sedentary is quite detrimental to your health and wellness. Activity and exercise triggers these C6 and C10 proteins that drive growth and repair of tissues, namely cartilage over your joints and your muscles and your bone. It's important with doing vigorous exercise that there be a balance between the exercise and recovery. And it is important with aerobic exercise to get your heart rate up for a period of time between the 65th and 85th percentile of your maximum. And there is a formula here, and it's also in their presentation. Catherine Carpenter did also emphasize resistance training and its benefits in her portion of that presentation. So to review more in activity and exercise, activity is all things that we do that involve moving. It's being non-sedentary. The more we do, the better off we are. Exercise, again, is broken down into aerobic and resistance training, and we get benefits from both, namely improving joint pain, balance and mobility, reducing stress and anxiety, and improving mood. It helps us lose weight and, more importantly, maintain weight loss. It improves insulin sensitivity and lowers blood sugars. It reduces blood pressure and it improves sleep. Now our next topic here, I've drawn these arrows in between sleep and meditation / stress reduction and our community, our network, because these are all interrelated. If things are not going well in your social network, your work environment, your family household, it affects our stress level, it affects our sleep, that affects our ability to want to exercise, and it affects our ability to adhere to a healthier diet. All of these are interrelated. We had a nice presentation by Dr. Darshana Bhattacharya and Jill Madison, who owns Uplifted Wellness, the yoga studio. Dr. Bhattacharya discussed cognitive behavioral therapy and that it can be used to help change negative thinking, negative self-talk, and help you develop skills to make yourself successful with whatever you're trying to achieve. And in this case, we're talking about making lifestyle changes to improve health and wellness. Stress reduction is key. There are many ways to reduce stress, but yoga is quite popular and can be done in your chair, as demonstrated by Jill, and can improve mindfulness and reduce stress. Lastly, sleep, which was covered very well by Dr. Greetens. The lack of sleep has very significant detrimental effects on your heart, your thinking, your cognitive abilities, anxiety, depression, and more. And this also can affect metabolic health. Dr. Greetens gave a nice summary that I've outlined here, essentially on sleep hygiene. These are things you can do at home beginning today to try to improve your sleep. The first is setting a schedule for sleep, planning to go to bed at about the same time and wake up at about the same time. Making sleep a priority is a must, because if you need 8 hours of sleep and you only allot 6 hours, clearly you won't get 8 hours of sleep. It has to be a priority. We know from extensive study that electronics, so that's bullet point 3 there, this is your phone, your iPad, your TV, disrupt sleep, and they should be turned off an hour before you want to go to sleep. Your sleep space should be a dark, quiet room and on a bed that's comfortable for you. Caffeine should be avoided after probably noon or 2 o'clock, depending on the individual. And it's best if you don't eat or drink alcohol 2 or 3 hours before you plan to go to sleep. Regular exercise can also improve sleep. So, putting this all together, I don't think there's a formula really to improve motivation, but I think one thing that can help is going back to our community and our relationships. Making a change, a lifestyle change, is hard, and having support from those closest to you will make you the most successful, especially enlisting whoever is living in your house, your immediate family. This enlistment can help them to not sabotage you in your efforts to make these changes. It's not helpful if your husband or wife or your kids have ice cream and cookies and candy in the home and you're really trying your best to avoid those. A supportive friend or family member might go for a walk with you or do other activities that don't involve eating, or might be involved with cooking a healthy meal with you. Making a significant lifestyle change is a huge commitment. It takes time. You should do some deep reflection if you have a very busy schedule to figure out, is this the right time for you to embark on this kind of journey? But in the meantime, you can make small changes. It's a good way to start. So these are some ideas we have for the future. And ideally, we'd like to do these in person, so it may have to wait until after the COVID pandemic. But we've been brainstorming about a 6-week lifestyle change class using the techniques of cognitive behavioral therapy. Again, this technique can stop negative self-defeating thoughts and help teach us how to set goals and reach goals to improve our metabolic health and lose weight if that is part of our goal. We've also thought about a 4-week cooking class. That might be a lot of fun. And we've also talked about developing another series of lectures on various topics. So if you have ideas, we are definitely open to them. I want to thank you for attending our wellness series, and we look forward to seeing you next time. Thank you.